my topic is a look at future of healthcare workforce and AI and digital health. How can we use it more efficiently in education? So we have to fast track learners, as you know, I'll get into that, but never fast track the standard. That's my motto in this particular session. If you look at the pressure on healthcare, it's immense. It is estimated somewhere around 11 million healthcare workers needed by 2030. The shortage is more severe in low and middle income groups, middle income countries. I'll give the nursing for example. If you take Pakistan, they have 220 million population. How many nurses they have? Around 120,000. According to WHO, the nurse to population 10,000 standard is about able to have minimum 30. So Pakistan has only 5. So now Pakistan production of nurses, training of nurses for a year, it's about somewhere around 10,000, 11,000. So for Pakistan, in reality, Pakistan to get the 1 million nurses that they need today, their gap is 1 million. It will take 175 years. I'm repeating that again. Pakistan needs 1 million nurses today. The output is about 10,000 per year. So it takes about 175 years for them to get 1 million. So that's the severity of this training need. In Sri Lanka, we need another 20,000 nurses. We produce 3,000. So in 7 years, we should be able to achieve that if nothing changes. Right? That is today's demand minded. Think about another 5 years down the line. So it's very frugal. It's very scarce. Our the healthcare systems. So we, as educators and technological experts, we have to support this. How to get maximum out of the existing resources that we have. So in the last year, the year before, I presented a paper on Commonwealth midwifery and nursing and midwifery federation about how to train nurses in no quick time. So I used this name called Work Ready Nurse Fast. That was my presentation. I worked with several other consultants, experts, and we wanted to train nurses not in 3 years, 2 years. So it was we could, because there are 120 procedures we'll have to do, that to be done in 2 years. They can put into the practice to training, but the registration could be given in 3 years. That was the background that we looked at. So now things happening in the world, you need nurses, you need experts, but how are you going to keep the standard, the quality? Knowledge can be given instantly, skill can be given fairly, moderately, fast, but the thinking nurses or the thinking healthcare professional, that takes another year. So you can't cut down the 3 years, but you can give the competence in no quick time and the knowledge. So education is kind of a dilemma. It's very slow and outdated. If I go back to Pakistan needs about $100 million to at least to invest to double the current production. So it has been the Pakistan Nursing Council is opposing the faster production of the training. So there is a political, there is a traditional mindset, all that are fighting each other, whereas the patients are suffering and the nurses are suffering because there's massive dropout from their jobs because they can't tolerate the current pressures. So if you look at the pressures that we have in healthcare education, of course the workforce scarcity, existing workforce is under pressure and health systems under pressure, learners are changing, teachers are between two worlds, and then of course the job description is changing. So AI and digital health are not add-ons. there are tools to redesign the learner's journey. Let's look at how it is. The scarcity of health workforce I just mentioned, and it's about you need numbers and you need quality people coming out, because they are facing the challenges, more challenges than what the previous seniors faced. So going at the existing workforce under pressure, because they not only get complex diseases, new diseases, and the consumer is more knowledgeable than them. There's a lot of pressure from them to ask for a better care, high-end care, and then you have to spend a lot of time in explaining them why you take this particular decision. The clinical decisions are challenged by the patients, not only by the patients itself, by the media, by regulators, by politicians. So there's healthcare workforce is under tremendous pressure. We haven't seen that ever before. They want digital documentation and reporting. So there's a system, a manual system, and a digital system both in our part of the world. So now then they have to have other work as well. Are they going to be a glorified clerks, or are they going to be a tech savvy people who use technology and move on? And on top of that, you have students coming around you. You have to supervise them, and most of them are not properly trained to do clinical training. And then on top of that, they have enough work. So are they doing the proper clinical training? Questionable. And then the other thing is, once you get the students into the learning environment, are they prepared to learn in this particular environment? Will you allow them to be around this environment? If they are not prepared, who takes the decision? What are the measurements that we have? What are the standards that we have? If somebody's having some tick boxes corrected, and then say, okay, this trainer, this learner is okay to go to a hospital setup, clinical setup. A, B, are they mentally competent? Are they physically competent? I know all our students at IIHS over the years, I have seen them, they basically lose at least 3 to 4 kilos while standing in a hospital when they start the clinical training. Right? So they become very agile, but those are the things that we have to look at. So educators must shift learning into safe, structured, simulated environments before they real patient exposure. Let's look at those. Health systems are becoming digital. So then, are we training one of the things Dr. Shamika mentioned, some of the systems we fail because we don't have a module even to train. Now we have a little bit of modules here and there. I'm taking nurses as an example. So once they go in, they think this as a model rather than looking at positively in that. So, so are we training them on electronic medical records, telehealth, wearables, remote monitoring, data dashboards, and then of course the AI supported decisions. So are we training our staff in the clinical environment? Are we training our staff before they become qualified staff? So therefore it's important, it's paramount that we all look into that very closely. Then the learners are changing. They are tech savvy. You know, their attention span is less now. They are more visual learners, and we were the linguistic learners. We had a 3D learning capabilities of the multiple intelligence theories. You know, there are 8 learning styles that we had. Now they are more visual, and then they are mobile. They are impatient with lectures. You can't sit in for a long time. And already they are using AI. They can search and get info, but can they verify? That's another question. They can use AI. Do they know the limits? They can communicate online, but may not protect patient privacy. So those are the things that challenges will come in when the learners they are changing their patterns. And the education task is to convert digital exposure into digital discipline. So we generally as educators, we try to, education is not only giving knowledge and skill and qualification, it's a holistic change of the personality, professionalism, all that to create the real global professional. But we are looking at their physical behavior, are we looking at their digital behavior? Good question to answer. Teachers are now teachers. They are in between two worlds. So traditional, we had a lecture, we had a textbook, and mostly linguistic learning, teaching, and we have a final exam. Still, some of the government nurses training schools, they have the final exam, and then they are all paper records. And once going into digital world, it's changing. AI supported learning is it's much easier to do. How are we going to use it? And simulations. You can simulate the student before they go into the actual clinical environment. You can simulate the existing staff to train before, to reduce the risk levels. And risk is not only the risk for the patient, it's a risk for the professional as well as the student. How to use analytics in a more proper way on critical thinking and evidence-based thinking, all that is important as a healthcare professional. How to use telehealth and of course digital assessment. So we've started a simple system in 2025. We named it as Empower Health and Wellbeing. It's the Empower HW. I'll be talking to the two doctors and the professor about it, how much that we can do. We looked at NCDs rising. We devised a simple software using the international health standards on simple variables. So we have already screened about nearly 2,000 patients and given a QR code where they are standing on their nutrition, sleep, the exercise, and then of course alcohol and smoking. Simple ones to adapt their lifestyle. So then going to pressure number 6, the job descriptions are changing. When you go to work, things are different now. What it was. Are we changing our curriculums? Are we training our training modes in order to make them work-ready professionals in the work environment? So HIS, Health Information Management, cybersecurity, because in the slightest thing if you use, the whole system can go off. That might directly impact the critical care patients, and all the machines could go haywire. It's a very big area to look at. It's not easy for us to look at. It's a very, very sensitive area. And then continuous training, telehealth, how to use telehealth, when are you going to use telehealth, and what's the privacy and confidentiality areas, and how to use augmentation, AI augmentation in your day-to-day work. So job descriptions are changing. There's a massive resistance from the respective boards to change immediately, but that's in a way good, but we'll have to look at the reality. So most health roles are expected to be augmented, not simply displaced by AI-enabled technologies. If the ward manager, if they don't get qualified or trained in AI and digital health, there will be a problem for their job security. There will be years to come. There will be jobs just on physical work. You will have to get this AI and technologies into your bucket list. So, what can we do as educators? We have to shift from the time served to competence proven. Shift from time served to competence proven. We can do. I told you that we created a concept called work ready nurse path. It's a good concept, but does it mean that we'll produce more and send them to the environment? They can't take a proper critical decision. So that's what we specifically make sure that they will get the license after 3 years. So they do 2 years of hardcore training, and then 1 year of internship, thorough internship. That's what we really need today. We need thinking healthcare professionals, not only qualified healthcare professionals. So that gap is the one there. So it's not how long did you learn to study, can the learner perform safely in their workplace. So that's where we have to move in. Loads of work has to be done in this particular area. So AI and digital health are tools to manage the learner's journey, not excuses to lower standards. So there's a 6R model for future healthcare workforce training. If an organization is looking at training organization, is looking at training healthcare professionals for the future, first we have to recruit the right learner and the right attitude. Attitude is very important in healthcare. We need not to mention this. You can be highly qualified, but if the attitude, there's a gap in attitude, healthcare services, the quality can go down. And then the proper learning styles. Has to be evaluated, and then see the gaps early before you get the learner into the environment, and have a separate plan. And then probably you have a standardized curriculum. You might change a little bit to suit the learner as well. So there is a delivery, how to deliver the programs, and then how to assess them. I think Mr. Diane will talk about it more on this. And then once you have that, test them, rehearse through simulations, whether they have the real competence. Simulation is one big area that we have to go into more and more into that. There are enough tools, there are enough technologies for us to do that. They reinforce with AI and digital support. So simulation could be physical, simulation could be augmented by the digital support. I think the augmentation word is a better word in healthcare, especially in training, and of course healthcare services, for us to use AI and digital health. Then of course once they are qualified, they are competent, that you are 100% competent, then they can release them to the work environment. So we can manage the entire journey, entry to support, to practice, to assessment, and work readiness. So we only release work-ready graduates rather than qualified graduates. So simulation is one big area that you can work on. You can fast-track the experience and protect the patient safety. Now, if you are looking at a work-ready professionals, to do that, it's always better you do simulations. When you simulate, it really goes to your memory, and you are physically doing it. There's a 3D space that you are working on. So therefore, it's very important not only for early learners, but of course working professionals as well. Simulation compresses the experience without risking patient. Patient is not there, so you reduce the risk levels. We can use in emergency responses communication. You can use technology for communication and empathy, whether are they competent enough to their level of empathy, communication, digital documentation you can do, infection control you can do simulations, telehealth and consultation, same thing, teamwork under pressure. You can create them different scenarios where how they react under pressure. That's very important. So simulation does not reduce the quality, simulation protects the quality. Yeah. AI as a learning accelerator. Where can we use AI? AI should help us to manage the learner better, not replace the teacher. Absolutely, yes. For learners, there is AI tutor, practice cases, you can practice cases. There's language support. If you have most of us in this part of the world, we have a problem in language, so you can use that. Then you can have revision plans through AI. You can, that's also could be done. For teachers, of course, you can design multiple cases, multiple scenarios. You can design quizzes, and hours and hours. I can remember when I got involved in IIHS, we used to do the MCQs continuously. It takes about a month to do about 40 MCQs. So now it's much easier for you to do. You can get the the best MCQs around the bank, the whole world, and you can bring them to Sri Lanka and then use them and then validate and use them. Feedback drafts can be used from the patient or from the teachers and the staff, of course. The weak learners, alerts, that's another important area. To identify the weak learners, you can trigger them if you put up the systems in place. For quality, learning analytics, we can see how they progress across their learning journey. They can track that, and competency of evidence. That's also can be used, and of course, flagging the risk is also important. That could be done by AI accelerators. So use AI to accelerate preparation, not to lower standards or remove human judgment. Human judgment has to be there. So that's what I mentioned. We are in the process of reversing the technology. We found that some of the learners, their competencies are good, but in terms of application, there is a gap. So therefore, we are in the process of going back to the vivas, more vivas. We are going back to more physical evaluation. We are going back to more integration by human judgment. So finally, the quality protection, the standard is non-negotiable. The training cannot be replaced by AI, but can augment AI. AI can augment our training methodologies. We do not fast track standard. We fast track the learner's journey, not the standard. That's why I specifically mentioned if it's a 3-year program, you have to keep at 3 years. That's a duration given to them. But inculcating the knowledge and skill could be done within 2 years, and then put them into a deep end in the learning environment. That's a clinical environment. So competency checklists, simulation sign-offs, mentor feedback, digital portfolios, employer input are very important in this. So finally we should ask, is this graduate safe, skilled, ethical, compassionate, or work ready? So these are the things that we can look at, and then of course, if you're looking at a roadmap, you can you are starting from scratch. You can organize the policy and readiness first 3 months, create AI policy, digital skill baselines, faculty orientation. Initially you start within first 3 months, then you can move into curriculum redesign. Look at the curriculums and inculcate digital health modules, simulation cases, and probably competency rubrics you can redesign. Then 6 to 9 months, you look at pilot, implement those AI supported tutoring, simulation sign-offs, and learning analytics. You can do that. And then finally, 9 to 12 months, scaling, and while looking at the quality assurance. Then once they move in there, you can get the employer feedback, clinical environment, the graduate readiness. You can have standards, and of course, continuous improvement. We have to start small. That's what we did over the years. Measure constantly, monitor them, and protect the quality, and then scale afterwards. The world does not simply need more healthcare graduates. It needs safe, skilled, compassionate, digitally capable, and work-ready professionals. So we fast track the learner again, never fast track the standard. Thank you.